Hi, it's Dr. Tanzi, and I'm here with the skincare tip of the month. And since it's April, which is Rosacea Awareness Month, let's talk rosacea. So when I talk to my patients, I usually tell them we're looking at 4 different components to manage their rosacea. Number 1 is you want to avoid triggers that make yourself flushed and red. The 2 biggest are really hot, steamy things like hot tubs, saunas, steam rooms, hot yoga. You want to try to stay away from that if you have rosacea. And also very cold things, cold and windy. If you're a skier, you want to really protect your skin while you're skiing. There's lots of other triggers. A good idea if you have rosacea is to go to rosacea.org, and it gives you a whole bunch of information about the triggers. Number 2, topical treatments for rosacea. Your board certified dermatologist can give you lots of prescriptions to keep the bumps and breakouts in check, but also over the counter, you can go either online or to the local drugstore to get something that contains sulfur. I know it doesn't smell very nice, but it actually does a really good job controlling some of the little pimples that break out with rosacea. Number 3, lasers and light-based treatments. They're fantastic to keep the skin redness in check and to try to reduce some of the blood vessels that break with rosacea over time. And number 4, oral antibiotics. I like to keep these in my back pocket for people who have really the worst cases of rosacea. They're really breaking out and flushed all the time, or if they have ocular rosacea, which means it's irritation in their eye, and we want to limit the amount of oral antibiotics that we use, but sometimes they can be extremely helpful with rosacea. So again, if you are like me and have rosacea and it's a difficult skin condition sometimes to manage and you can't cure it, but you can certainly do some things to keep it in check over time. So that's my tip of the month.